Thank you, Mr. President. I rise to explain my vote. I want to first thank Senator Brooke for bringing forth this important legislation, and equally important for her impactful advocacy for these critical services. When thinking about the premises and the need for this legislation, what it is doing is that it is directing the Office of Mental Health to establish a maternal mental health work group. This legislation will improve postpartum outcomes for mothers and birthing people and families impacted by maternal mental health disorders and depression annually. And one of the things that Senator Brooke always points out is that we have to treat the totality of our mothers and their experience and their birthing experience. And this legislation will strengthen our capacity to diagnose and treat women, especially underrepresented and vulnerable populations. Black and brown mothers are most likely to experience postpartum depression and least likely to receive treatment, with a staggering number of cases estimated to go undiagnosed or unreported. This disparity in care puts Black and brown mothers and their families at even more risk for the worst mental health outcomes. And as a state, we can and must do better. As the chair of Women's Issues Committee, I am proud of the work that we are doing to increase safety and improve outcomes for mothers and birthing people, both during birth and during the postpartum period. And again, I want to thank Senator Brooke for her leadership on this issue. I proudly vote aye, and I encourage my colleagues to do the same.